So I'm the Chief Medical Officer at Beijing United Family Hospital. I've been in China now for 5 years, having gone there from the United Kingdom. I'm responsible for serving our patients and helping our doctors and the rest of the teams serve our patients. So we obviously need to put patient outcome as the most important thing that we do, but we've got to make sure that we do it in a way that's safe and that we know improves the quality of care for our patients. So in the past, we went from public health systems to evidence-based medicine, and now the big agenda is value, is actually giving good value, which is outcomes divided by cost, to our patients whom we serve. So what the information technology allows us to do, it allows us to really track what's happening to our patients all the way through their journey. And it's a 360-degree look at how our patients are going through our system. Because I work in a healthcare system. So we have hospitals in Beijing, Shanghai, Tianjin, other cities in China, and also actually now we also have a hospital in Mongolia. So to be able to tie all that, what's called interoperability together, has really revolutionized the care that we can give to our patients. A very good example, actually going from evidence-based medicine, there are 3 things that we need to do. One is use the latest evidence. Actually, even in the States, you find that half of doctors do not provide the latest evidence-based care. So that's one way, actually bringing that evidence to us so that we know what is current. The second thing to take into account is what the patient wants. So what I mean by that is, let's say there's a woman who has cataracts. Her goal might be to be able to watch television. So we do what we can to improve her health, and then we can now measure her goal and document her goal and ask her, can she now watch television? And so we're able to tie in patient outcomes using the same electronic database. And the third really important area is the physician experience, the experience of the doctor. And it's not just the doctor, it's the nurses and so on. So in order for us to apply our wisdom, our experience, we need to have all the information, all the data that's available to us. And again, electronic medical records allows us to do that. We can see much more quickly, in a way never before imagined. We can see all the data. And so we can then apply our wisdom, our experience, to that data to provide real information to help us serve the patient better. So I think the single most important thing to do is for every doctor, every nurse, every administrator to keep patient outcomes, to think of things from the patient's perspective as the vision as to what we're all about. So it is no longer about the physician, it is not about the nurse, it's not about the manager. I hear people talk about how to engage the physician. Actually, physicians, we all want to serve the patients. And as long as we keep that in mind, the rest follows, because that's our yardstick. If we were to think, well, what's in it for the physician, and what incentives can we give them, and so on and so forth, we completely lose the plot. We completely lose the reasons why we're in healthcare. So I think vision and focus on that vision is really important. The second thing is to not let other things get in the way, to not be distracted, and to see how this new system of working within the digital sort of framework actually can help us, because there's a learning curve. And so we have to want intrinsically to get over that learning curve to see the goal at the end. So it's easy to get sidetracked, and we shouldn't allow that to happen. the third area, which I think is really important for helping all the end users, is to think about how we use the data that comes out of that. And one of the key steps in that, well, there's a number of key steps. One key step is we have to put in really accurate data in the first place. So it might be very quick to just say, oh, the diagnosis is something quite general. But actually, the more accurate the data goes in, the better data we get out. That's one thing. The second is, we're a system of hospitals, clinics, across China and now in Mongolia. So as a system, if we want to compare how we do with each other, if we want to aggregate the data, we have to agree on common standards, common definitions, and not think, well, in Beijing we do it this way, in Shanghai they do it that way, and allow it. You have to bring it all together and say, guys, the rewards are worth it at the end. Let's sacrifice what we might think is the right way of doing it. Let's do it in a united way.